Hello, my name is Michaela Humphreys, and I'm going to be discussing 3 research articles connected to men with antisocial personality disorder. This first article is called A Psychometric Investigation of Gender Differences and Common Processes Across Borderline and Antisocial Personality Disorders. The purpose of this study was to investigate the covariance structure of borderline and antisocial personality disorders. They also wanted to measure invariances of the structure across sex, as well as examine how borderline personality disorder and antisocial personality disorder might predict other clinical outcomes such as anxiety, depression, substance abuse, and so on. The results of the study further supported other studies by showing that women scored higher in regard to borderline personality factors, while men score significantly higher in antisocial personality disorder factors. They also showed that there is a common underlying vulnerability that accounts for the comorbidity between the disorders, thus providing an association between the disorders and substance use issues. When examining the predictive utility with other clinical outcomes, they found that antisocial personality disorder predicted lifetime number of days in jail. The highest factor found connecting antisocial personality disorder and incarceration was failure to conform to social norms with respect to lawful behaviors as indicated by repeatedly performing acts that are grounds for arrest. Antisocial personality disorder was also associated with early age of alcohol initiation. The researchers also proposed that it would be beneficial to combine borderline personality disorder and antisocial personality disorder into a single classification for studies of etymology and treatment. While this may or may not be beneficial, I have noticed that they are studied together a lot. The next study is called The Violent Accounts of Men Diagnosed with Comorbid Antisocial and Borderline Personality Disorder. This study's purpose was to look into the process behind violence perpetrated by offenders diagnosed with both antisocial personality disorder and borderline personality disorder. The study was conducted on 6 inmates serving life sentences. This study was also done in interviews. The researchers found 4 main themes. The first was victims of a hostile and rejected world. In this theme, they found that the participants felt rejected, alienated from others, and victimized by society, specific people, or both. This leaves them feeling powerless. They externalize responsibility for bad outcomes in their lives, or in other words, it's not their fault. Most participants experienced these feelings or thoughts as a build-up to their violence, and some experienced it during their violent outbursts. Theme 2 is self as unacceptable to others. Here, participants express that they felt unwanted, inferior, or invalid in regards to others, culminating in a sense of shame. Their self-worth comes from relationships with others. Without them, they feel loneliness and empty. However, there were no reports of self-criticism, as you might suspect. There was high levels of rumination on external factors. Theme 3 is unwanted emotions that cannot be tolerated or controlled. Participants reported feeling an extensive range of emotion that becomes overwhelming. They often turn to alcohol or substance use to try managing or suppressing these emotions. The final theme is violent revenge as catharsis. This often follows angry rumination involving revenge images that can last from a few hours to a few months depending on the person. They use these violent outbursts to obtain a sense of relief from their emotional turmoil by gaining control, thus escaping their feelings of shame and loneliness. Following these violent episodes, participants reported feelings of calmness, numbness, in place of the emotions. Researchers found that shame is a key component leading to aggressive or violent behavior. This last article is called Early Adolescent Aggression Predicts Antisocial Personality Disorder in Young Adults. It is a population-based study. The purpose of this study was to investigate the possibility of predicting a diagnosis of antisocial personality disorder in young adults by observing aggressive behaviors in adolescents. In this study, adolescence is defined as ages 12 to 14. The results show that it is possible to predict an antisocial personality diagnosis for young adults by observing aggression in adolescents. Across both sexes, Those later diagnosed with antisocial personality disorder had high aggression scores in adolescence, while males consistently had higher aggression scores than females. The subtype direct aggression predicted antisocial personality disorder almost as well as total aggression, while the subtype indirect aggression, though not as powerful a predictor, still helped predict antisocial personality disorder. They did find that social anxiety was not a predictor. The researchers also found that the more informants, such as teachers, parents, the participants, or siblings, had a higher accuracy for predicting antisocial personality disorder. And here are my references.